Hepatocellular carcinoma, often abbreviated as HCC, is a type of liver cancer. It is a primary liver cancer, meaning it originates in the liver itself, rather than spreading from another part of the body. This type of cancer is particularly aggressive and can grow rapidly, making early detection crucial for effective treatment. It begins in the cells of the liver, known as hepatocytes. These cells are responsible for a variety of important functions, including protein synthesis, detoxification, and the production of biochemicals necessary for digestion. HCC is the most common type of liver cancer found in adults. It accounts for approximately 75% of all primary liver cancers, making it a significant health concern worldwide. It frequently occurs in individuals who have liver damage caused by conditions such as cirrhosis or hepatitis B or C. Chronic alcohol consumption and fatty liver disease are also major risk factors that can lead to the development of HCC. The liver is a vital organ that performs many essential functions, including filtering toxins from the blood, producing bile for digestion, and storing energy. It also plays a crucial role in regulating blood clotting and supporting the immune system. When cancer affects the liver, it can disrupt these functions and seriously impact overall health. Symptoms may include jaundice, abdominal pain, and unexplained weight loss, which can significantly affect a person's quality of life. Understanding HCC is crucial because it is a serious condition with potentially life-threatening consequences. Awareness and education about this disease can lead to earlier diagnosis and better outcomes for patients. However, with early detection and appropriate treatment, the chances of survival improve significantly. Regular screenings and monitoring for those at high risk can catch the disease in its early stages when it is most treatable. This essay will delve into the causes, symptoms, diagnosis, and treatment options for HCC, empowering individuals with the knowledge to recognize warning signs, seek timely medical attention, and make informed decisions about their health. By understanding the risk factors and the importance of early intervention, we can work towards reducing the impact of this devastating disease. Hepatocellular carcinoma doesn't typically develop in a healthy liver. Several factors can increase your risk of developing this disease. The most significant risk factor is cirrhosis, a condition where scar tissue replaces healthy liver tissue. Cirrhosis can result from chronic hepatitis B or C infection, heavy alcohol consumption, or non-alcoholic fatty liver disease. Other risk factors include exposure to aflatoxin, a toxin produced by certain molds found on improperly stored grains and legumes, obesity, type 2 diabetes, and genetic disorders like hemochromatosis. Understanding these risk factors is crucial for prevention. By managing underlying conditions like hepatitis and avoiding excessive alcohol consumption, individuals can significantly reduce their risk of developing HCC. In its early stages, HCC often doesn't cause any noticeable symptoms. As the cancer grows, it can lead to a range of symptoms, including unexplained weight loss, loss of appetite, abdominal pain, especially in the upper right side, swelling in the abdomen, also known as ascites, yellowing of the skin and eyes, referred to as jaundice, itching, nausea, and vomiting. It's important to note that these symptoms can also indicate other, less serious conditions. However, if you experience any of these symptoms, especially if you have risk factors for HCC, it's essential to consult your doctor promptly for proper evaluation. Diagnosing HCC, or hepatocellular carcinoma, typically involves a combination of tests and procedures to accurately identify the presence and extent of the disease. Blood tests are one of the first steps in the diagnostic process. These tests are crucial as they provide initial insights into the liver's health and functionality. These blood tests check liver function and look for specific tumor markers like alpha-fetoprotein or AFP. Elevated levels of AFP can be a significant indicator of liver cancer. Elevated levels of these markers can indicate the presence of cancer, prompting further investigation through imaging and other diagnostic methods. Imaging tests such as ultrasound, kinetic scans, and MRI provide detailed images of the liver. These imaging techniques help doctors visualize tumors, assess their size, and determine their exact location within the liver. In some cases, a biopsy may be necessary to confirm the diagnosis. This involves extracting a small sample of liver tissue for closer examination. During a biopsy, a small sample of liver tissue is extracted and examined under a microscope for cancerous cells. This step is crucial for confirming the presence of hepatocellular carcinoma. Early diagnosis is crucial for successful treatment. Detecting HCC at an early stage can significantly improve the prognosis and expand the range of treatment options available. If you have risk factors for HCC, regular surveillance with blood tests and imaging may be recommended to detect any abnormalities early on. This proactive approach can lead to earlier intervention and better outcomes. Section 5. Treatment options for HCC. The treatment approach for hepatocellular carcinoma, or HCC, depends on several factors including the stage of the cancer, how far it has spread, the patient's overall health, and their preferences. Each case is unique and the medical team will consider all these aspects to recommend the most suitable treatment plan. Treatment options include surgery, where if the cancer is detected early and confined to the liver, surgery to remove the tumor may be an option. This can be a curative approach, especially in patients with small localized tumors. However, surgery carries risks and requires a thorough evaluation of the patient's liver function and overall health. In cases where surgery is not feasible, a liver transplant may be considered. This involves replacing the diseased liver with a healthy one from a donor. Liver transplants can offer a chance for a cure, but they are complex procedures and require the patient to be in good enough health to withstand the surgery and recovery process. Ablation therapy is another option, which uses heat or cold to destroy cancer cells. Techniques such as radiofrequency ablation or cryoablation can be used, often guided by imaging technology to precisely target the tumor. This method is less invasive than surgery and can be suitable for patients who are not candidates for surgical procedures. Radiation therapy involves high-energy rays to kill cancer cells or stop them from growing. This treatment can be used to shrink tumors before surgery, or to relieve symptoms in advanced cases. Advances in radiation technology have made it possible to target tumors more accurately, minimizing damage to surrounding healthy tissue. Chemotherapy uses anti-cancer drugs to kill cancer cells or slow their growth. These drugs can be administered orally or intravenously and work by targeting rapidly dividing cells. Chemotherapy can be used alone or in combination with other treatments, depending on the specific characteristics of the cancer. Targeted therapy involves drugs that target specific molecules involved in cancer cell growth. These therapies are designed to interfere with the cancer's ability to grow and spread, often with fewer side effects than traditional chemotherapy. Targeted therapies are a growing area of cancer treatment, offering new hope for patients with advanced HCC. And then there's immunotherapy, which uses the body's immune system to fight cancer. This approach can help the immune system recognize and attack cancer cells more effectively. Immunotherapy has shown promise in treating various types of cancer, including HCC, and ongoing research continues to explore its potential benefits. The choice of treatment is tailored to the individual patient and their specific circumstances. Factors such as the patient's age, overall health, liver function, and personal preferences all play a role in determining the best course of action. It's a collaborative process between the patient and their healthcare team. It's essential to discuss the benefits and risks of each option with your doctor to make an informed decision. Understanding the potential outcomes, side effects, and impact on quality of life can help patients and their families navigate the complex landscape of HCC treatment. Always seek a second opinion if needed, and stay informed about new and emerging therapies. Section 6. Advancements and research in HCC treatment. Significant progress has been made in recent years in the treatment of HCC. Researchers are continually working to develop new therapies and improve existing ones. Immunotherapy is showing promise in treating HCC, with some drugs demonstrating the ability to shrink tumors and improve survival rates. Targeted therapies are also being developed to specifically target the molecular pathways involved in HCC growth. Researchers are exploring new ways to deliver chemotherapy more effectively to the liver, minimizing side effects on other organs. Clinical trials are ongoing to evaluate the efficacy of new drug combinations and treatment approaches. These advancements offer hope for improved outcomes and a brighter future for individuals diagnosed with HCC. Section 7. Living with HCC Prognosis and Support. Living with HCC can be challenging both physically and emotionally. The prognosis for HCC varies depending on the stage at diagnosis, the patient's overall health, and the effectiveness of treatment. It's essential to have a strong support system during this time. Family, friends, and support groups can provide emotional support, practical assistance, and a sense of community. Palliative care is an important aspect of HCC management, focusing on relieving symptoms, improving quality of life, and providing emotional and spiritual support for patients and their families. Section 8. The importance of early detection. Early detection is crucial for improving the chances of successful treatment and survival for HCC. When detected early, HCC is often curable with surgery or transplantation. Individuals at risk for HCC, such as those with cirrhosis or chronic hepatitis B or C, should undergo regular surveillance with blood tests and imaging as recommended by their doctor. Being aware of the symptoms of HCC and seeking medical attention promptly if any arise can also lead to earlier diagnosis and treatment. Section 9. Conclusion. A call to action. Hepatocellular carcinoma is a serious condition, but with early detection and appropriate treatment, the chances of survival are significantly improved. Understanding the causes, risk factors, symptoms, and treatment options for HCC is crucial for both prevention and early intervention. If you have any concerns about your liver health or believe you may be at risk for HCC, consult your doctor for personalized advice and guidance. By prioritizing liver health, recognizing warning signs, and seeking timely medical attention, individuals can take proactive steps towards protecting their well-being and potentially saving their lives.